single day, like I've always done and always will.
Passing these bills on the floor, making yet another stand.
Welcome to this week's edition of New York Now. I'm Chantel Destra. The April 1st deadline for the state budget came and went this week with leaders unable to come to a final agreement. Governor Kathy Hochul signed 2 extenders, officially pushing the budget deadline to next week. The biggest points of contention this year are changes to the state's discovery law, approaching involuntary commitment, prohibiting cell phones in schools, and tackling mask bans. Leaders are also negotiating the state budget with the looming backdrop of potential cuts from Washington. While nothing is set in stone at this time, Governor Kathy Hochul and legislative leaders have called on the New York congressional delegation to stand up against the cuts. Our Elise Klein has more on that story.
Enormous proposed budget cuts totaling in hundreds of billions of dollars in Washington has New York leaders concerned about the wave of potential harmful impacts for New Yorkers who rely on federal assistance programs like Medicaid, Social Security, and the Supplemental Nutrition Assistance Program, or SNAP. United States House Republicans are reportedly considering cutting $2.3 trillion in Medicaid and $230 billion in agricultural programs such as the SNAP program over a 10-year period. Governor Kathy Hochul says cuts proposed at the federal level won't be sustainable for the state. She says there is no way they can backfill those losses, highlighting New York receives around $93 billion every year in federal assistance to fund various programs.
Like, these cuts will have we will be the collateral damage, the roadkill in the way of these policies, because there's not a lot we can do about it. I'm not throwing in the towel. I'm just saying, realistically, how do I make up that money? It is not possible.
Hochul adds she plans to stand up, fight, and go to court if necessary. Other state leaders like Assembly Speaker Carl Heastie say Republicans in Congress, especially the 7 Republican representatives for New York, seemingly supporting these cuts, should be speaking up.
Donald Trump can't do any of these things budgetarily without the assistance of these 7 members of Congress. So again, they should be the ones that are they okay with cutting Medicaid to people? Point in fact, Congressman Lawler has one of the highest Medicaid recipient counties in the entire nation.
In a comment sent to WMHT, United States Representative Nick Langworthy, serving New York's 23rd Congressional District, said Medicaid and Social Security benefits will not be cut. Only, quote, waste and fraud will be rooted out. WMHT has reached out to all 7 New York Republican representatives repeatedly for this story. None of the other 6 representatives responded for comment despite multiple attempts. Congressional Democrats can't seem to get answers. United States Representative Paul Tonko, serving New York's 20th Congressional District, says Republicans have been awfully quiet.
Well, silence that is deafening. Speak up, share your opinion here. Why are you allowing the richest person in the world, a multi-billionaire, a MAGA billionaire, is wielding not even an axe. He's wielding a chainsaw at programs that are tremendously responsive to the needs of children, families, and individuals of all age groups.
Tonko adds he doesn't understand why Republicans are continuing silence on these large cuts.
Look, I'm not going to suggest that I can understand their motivation, but for whatever purpose, they need to begin to speak out, speak up, and show up.
Meanwhile, some state Republican leaders like State Senate Minority Leader Rob Ortt, representing Niagara and Orleans counties, say Congress will have their say, and they feel confident in U.S. Republican reps' ability to fight.
Congress is going to get their say. People like Mike Lawler and Andrew Garbarino and Nick LaLota and Nicole Malliotakis and Nick Langworthy and obviously Claudia Tenney, who I have spoken to about this, are going to get their say. They understand certain programs are important to New Yorkers. I think they're going to fight to try to make sure those are still there.
The Trump administration also continues to stress they only plan to cut, quote, waste and fraud in Medicaid dollars. At a presser about affordability, Ortt echoed similar ideas, saying the state spends too much money and unwisely. He says he feels the programs are not working properly.
The waste, fraud, and abuse in this state is terrible. It's terrible. So the idea that, we can spend money effectively to help people, and we should, especially for the poorest of folks who need help. But that's not what happens. You know what really happens? We spend money to prop up organizations to hire a bunch of people who are political operatives.
State Senator George Borrello, a Republican representing parts of the Finger Lakes, says he's very concerned about possible fraud within the Medicaid program.
There are still 1 million Medicaid recipients in New York State that are costing taxpayers billions of dollars a year that we cannot prove actually exist. They're likely fraudulent. They're likely a lot of folks there are a lot of bad actors, like a lot of providers that are fraudulently billing for people that are dead or moved or no longer get the service. So New York State has continued to essentially incubate fraud in our Medicaid system in so many ways.
However, some research experts stress this continued talking point by Republicans isn't well supported. Leo Cuello, a research professor at the Georgetown Center for Children and Families, stresses the actual policy proposal to cut Medicaid is not specifically targeted at waste.
Waste and abuse is not what this debate is about, because that is not what the proposals are on the table. The proposal on the table is there might be a rotten apple in this barrel, so let's pour out half of the apples from the barrel. Right? That's the proposal. It doesn't actually address where the rotten apple is, and you're going to just throw out a whole lot of good apples. They are proposing to defund the whole system to address something that they haven't even established exists in the program, which is waste, at least not any more than exists in Medicare and exists in private coverage as well.
Cuello also says the actions to effectively address waste lies with reporting and investigations at the federal and state level, which already exists. Every state has a Medicaid Inspector General, as well as the United States Medicaid Inspector General, who conducts investigations for suspected abuse.
The states and federal government, as we've said, already have auditors that do this, but we and others have recommended, hey, you need to do more. And that's what it would look like. Instead, we're seeing actually the reverse. The Republicans in Congress, one of their proposals is to repeal a regulation that improves reporting. And we're also seeing them make the administration propose and make massive reductions of HHS staffing that would be needed to do this.
State lawmakers like Assemblymember John McDonald, a Democrat representing parts of the Capital Region, echo the same point.
If there is that much waste going on, if they really feel that there's that much fraud going on, and quite frankly, they should be doing investigations.
Other state Democrats say these cuts have nothing to do with fraud. Assemblymember Jessica Gonzalez Rojas, a Democrat representing parts of Queens, says she's very concerned about the painful effects on New Yorkers.
It is clear that Republicans are on a rampage to cut health care services for New Yorkers, to defund critical social safety net programs, and honestly put us at risk of health inequities and possibly death for so many people that rely on Medicaid. We have about 7 million people here in the state of New York that rely on this life-saving program.
In addition to Medicaid cuts, programs like SNAP could have dramatic cuts. The State Office of Temporary and Disability Assistance Commissioner Barbara Gwynn says she is very concerned about the potential loss of billions of dollars for this program that in New York alone, about 3 million people rely on to put food on the table.
If the SNAP benefits are cut, certainly would be a significant hardship. I mean, the families who receive SNAP are relatively low-income households.
Gwynn says families could seek additional resources such as food banks, but the food assistance options are limited.
At the end of the day, it will be something that would be very difficult for these households to make up.
Some state and federal Democrats also stress these program cuts are directly related to Trump's desire to cut taxes by trillions of dollars for the wealthiest Americans, which make up a very small portion of the nation compared to those who rely on programs like Medicaid or SNAP. In 2017, Trump proposed legislation he desires to continue under his new reign, set to expire this year, to give tax cuts to the richest households, costing around $4 trillion over the next 10 years, which is about $400 billion a year. Representative Tonko says earlier in his career he voted against this policy measure because it was not and is not a fair distribution of wealth.
We need to be much more fair and progressive in our tax policy. Why would at the expense of that $4.5 trillion in savings that they sweep from the very many. So the outcome here is invest in tax cuts, gigantic tax cuts for the very few at the expense of programmatic assistance, healthcare, education, nutrition for the very many. It doesn't make sense.
Gonzalez Rojas says these cuts are cruel and simply an assurance for the richest Americans to gain even more wealth.
And this is about putting more monies in the pockets of millionaires and billionaires and taking from hardworking New Yorkers and people across the country whose social safety net is being decimated, and again, losing their health care and other vital programs that New Yorkers and other people across the country depend on.
In addition to program cuts, since Donald Trump took office, tens of thousands of federal workers have lost their jobs in varying agencies. Most recently, the newly formed Department of Government Efficiency, established by Trump via an executive order and led by Elon Musk, is looking to cut around 12% of the Social Security workforce, a program that serves around 70 million retired Americans each month. Tonko says he is utterly disappointed.
I think it's shameful. It's a disgrace. It's a disregard and a disrespect of workers. I consider, as a member of Congress, to be part of management, and I find myself apologizing for the outcome and the manner in which it was shared with the now fired worker.
For federal workers like Cheryl Young, a Social Security worker who recently protested against Trump and Musk's cuts to Social Security, the level of federal firings means she has to worry about her job security.
Every day is different. We all have ups and downs. Some days we're stronger, some days we're upset, some days we don't know if we are going to have a job in 2 weeks. The work that we do is so important. So personally, I think about my job and whether I'm going to have it. But mostly I think about what are the people in this country going to do as we watch everything continue to fall and crumble into rubble.
Young says she also worries about the people she helps at her job not being able to access services.
And the people at Social Security who receive our services need us desperately. This is not a fraud scheme. This is a need, and they paid for it, and we should be able to continue to deliver what our citizens have paid for.
At a recent press conference, United States Senator Kirsten Gillibrand, representing New York, said Trump and Musk's actions against Social Security will have catastrophic impacts on seniors and people with disabilities.
These people rely on Social Security to pay their rent, their food, their heating, their medical care, everything they need to survive.
Gillibrand says she is trying to fight back.
I'm asking for detailed information about the Social Security Administration's offices that have had their leases terminated, including 2 in our state. I'm also requesting more information about Social Security Administration's plans to cut the over-the-phone service. While the administration has allegedly scaled back on its initial plan, the damage is clearly already done.
Gillibrand is also trying to get her colleagues across the aisle to fight with her, but so far she says they are standing with Trump. She says if her Republican colleagues in the House and the Senate won't listen to Democrats, then they should listen to their constituents. With all of the potential cuts and changes at the federal level, some state lawmakers have expressed they might need to come back for a special legislative session after June to address this later in the year. State lawmakers have said if they have to come back, they'll come back. Many questions still remain, but one thing is certain. If lawmakers have to come back to Albany, they will certainly have a lot to sort through if we see these big cuts come through. Elise Klein, New York Now.
And along with negotiating the state budget, Democrats have also made access to abortions a legislative priority. A few weeks ago, a New York doctor was criminally charged for allegedly prescribing abortion pills to a patient out in Louisiana. Jung-Yoon Han of WXXI and the New York Public News Network sat down with Assemblymember Amy Paulin to discuss the case and what it means for New York.
Thanks for taking the time to chat with me.
Happy to.
So I first want to talk to you about a case involving a New York abortion doctor, Dr. Margaret Carpenter. She's been charged with criminal abortion in the state of Louisiana for sending abortion pills to a patient in that state. She's also facing civil charges in Texas for sending pills or two. You know, what do the charges that Dr. Carpenter's facing show about the state of abortion access in the country?
We know, after Roe was overturned, that we would have problems in some of the states, particularly where there were Republican majorities, and what we're seeing is evidence of that. So luckily, I live, you live, our families are here in New York, where those rights are protected for for women, but they're not protected anymore across the country. And there are many states that are going out of their way to be problematic.
Then what role do you see the state playing for patients in other parts of the country?
I think people who can afford it are going to come to states like ours. Abortion has changed. The way that someone can have an abortion has changed. And so, what's evidenced here, in the case of Dr. Carpenter, is that the medication that helps terminate a pregnancy can be much more easily transported than a doctor or a nurse who would need to do a surgical procedure. So I think that the role that we can play is to make sure that we stand behind Dr. Carpenter and other providers, to continue to allow them to do telehealth and to be able to transport some of the abortion medication to places that are problematic across the country.
President Trump, when he was campaigning during the 2024 presidential cycle, was saying that he sees this country, he thinks that the country should have a states' rights approach to abortion. Now that he's president, how do you think that approach is going so far? Is it working?
Well, as I said, it's in states where you're protected, it's working fine. But in states that are not protected, it's very problematic. I've heard so many families in my district say, I don't want my daughter to go to college there. I think that it's going to end up happening is we're going to see an aftermath effect. We're going to see families not want to live in some of those states. We're going to see doctors not want to practice in some of those states. We already have. So it's just going to get worse if the attitudes don't change. We've also seen voters take action where we thought a state was anti-choice. Voters have taken action and they haven't allowed some of those prohibitions to happen. So I think, it's just going to continue. Young people are not going to stand for the same injustices. They're rising up now, and I think that we're only going to see that.
For New York, for years, the state has been putting and passing laws to put together more abortion access and protections for New Yorkers and patients across the country too. And then in recent weeks, the governor passed a law that would make it easier or give the option for doctors to not put their name on abortion pill prescription labels. Right. How will your efforts build on that work?
So I have two bills. Probably the most significant one relates to how we dispense abortion medication in New York, and it would make it much more accessible for for our own residents and our own young people, women, but it would also help, I think, across the country. Washington State's already done this, which is to allow a non-patient specific script to be written. I'm going to say what that is because most people don't know, but a non-patient specific script to be written so that all you have to do is present at a pharmacy if you're pregnant and you want to terminate your pregnancy, and you can obtain the abortion medication. So what that means, first let me step back. So in India and Mexico, if you want to get an abortion medication, all you do is go to the drugstore and it's right on the shelf. So, and we don't know of any health contraindications. And doctors tell us that, and tell those who they're prescribing it to, if you have a health issue, bleeding excessively or some other aspect, which is very small cases, go to the emergency room. So it's not like you take the medication in front of your physician or in front of another prescriber, because more than doctors can prescribe medication or prescribe abortion medication. So what this script would do is something that we've just done recently with birth control pills in New York, which is to allow the Commissioner of Health or another prescriber, another physician, or any prescriber to write a script that basically goes to a certain pharmacy and says, okay, any person stepping in here that you believe needs, or it's a script so that me, the physician, to you, the patient, doesn't have to write it directly. It's me, the prescriber, writing it for multiple patients and sending it to a pharmacy, so that multiple patients can come in, or multiple clients, or constituents, residents could come in and obtain the abortion medication. And I could obtain it for my daughters. You could obtain it for your friends, and therefore it's more anonymous. And we could also, frankly, send it.
Right. What are the challenges that the state has been facing so far to make that possible?
Originally, when I introduced the bill, we had the problem that there were forms and applications that pharmacies had to fill out in order to be able to dispense, to have it in stock, to be able to dispense those medications. But now we don't have that anymore. Now we have big chains having that available. So that was a big hurdle we had to get over. As soon as we got over that hurdle, we knew that we could do this bill. And what I'm really hoping, because there's been some threats, to take back the availability of the medication to the pharmacies themselves. If that happens, we have a problem. But if it stays the way it is now, we could do this bill and we could make abortion medication much more accessible. And in fact, I would argue that the patients would then, the New Yorkers, the people who are actually getting the medication for themselves, would have a health professional, the pharmacist, very available. Pharmacies are, usually they're right down the street, right? Versus trying to get an appointment with a physician, or getting access even to the same physician you had a telehealth appointment with. So it makes it much more available and even more protected for the woman who's needing that procedure. So I think we have a large number of advocates who are now for it. We're making momentum, and I do think it's going to even help protect doctors like a Dr. Carpenter. We don't have that many doctors actually doing this work, so we want to protect them. And right now, Dr. Carpenter had to obtain the medication herself and mail it. This would allow the relative, or the friend, or, and we're not going to, Louisiana is not going to start extricating, all of, New Yorkers to say, wait, they are all dispensing abortion medication. We better, we're going to criminalize, or we're going to accuse everyone in New York City for this act. So that's not going to happen. This will make it impossible for those red states, those anti-abortion states, to do any kind of negativity toward our residents.
So this bill, in my mind, falls under a category of shield laws that New York State has about abortion access. Can you just walk through for our audience what shield laws are, what the current suite of laws about abortion access there are in New York related to that?
Well, aside from the one that we just did, right? That's what we're talking about, a shield law. It's shielding, right? Anyone from the potential of litigation or criminal prosecution. So that's what we're shielding, or we're, shield is the right word, or we're protecting. That's another synonym, right? We're protecting. So we have quite a lot. We have protections if you want to go into a clinic, for example. You can't. We protect people, from harm. If they want to enter a clinic for an abortion, we protect doctors. With the labeling, but we also protect doctors through phone book. We don't really have phone books anymore. So, but we protect. We have done a lot of things. And we do them across a lot of places, like domestic violence is a very common other example, where we say, okay, we want to shield them from, from being able to be found by their persecutors. So that's what we have attempted to do. I call on anyone who's listening to this, if you have any great ideas, to help us think of new ways to be able to help protect those people who are in the trenches doing this important work for women.
Well, thank you for taking the time to chat with me.
Thank you.
And we're speaking with Assemblymember Amy Paulin.
Well, that does it for this edition of New York Now. Thank you for tuning in, and see you next week.
Funding for New York Now is provided by WNET,